Secret number 2. Who's ready for secret number 2? Yay! Put up your hand and get excited. Secret number 2. There is one fundamental change that you can make to have an abundance of happy, satisfied clients and make more money. What do you think that is that's going to set you apart from everybody else? Well, I believe that it's all about knowing how to work smarter, not harder. You need to develop a more precise and targeted skill set to decrease the strain on your body and increase the effectiveness, your effectiveness as a therapist. And you also need to remember that you are your business and you are your most precious commodity. And you need to take care of yourself because massage therapy can be a very demanding career. So secret number 2 is all about what I call intelligent treatment. And during this masterclass, I'm going to take you on a tour of the neck and teach you about a challenging muscle group that requires very intricate and precise work. Plus, this is a taste of what you're going to learn if you choose to enroll in the Tissue Talk Academy. I'll give you all the exciting details about that at the end of this webinar, so make sure you stick around. But let's take a look at what I mean by intelligent treatment. It utilizes your knowledge and understanding of anatomy, physiology, and pathology. It requires a much more targeted and precise treatment approach. And as I said, it will provide your clients with more complete and longer lasting results. So let's dive in to the neck right now. Let's take a look at how we can provide more intelligent treatment for the neck. So the neck is one of the most common problems driving people into our practices. The neck is often referred to as the master volume switch because it affects pain patterns everywhere else in the body. Research shows that if you deactivate problems in the cervical region, everything else responds positively. So help people with their neck problems, and it's going to help the rest of the problems in the rest of their body. What are some other interesting things about the neck? Well, small positive changes in the neck region can make a massive difference in the rest of the body. Neck issues increase the likelihood of lower back pain by 3 times. Lower body and pelvic imbalances cause neck imbalances to worsen because the neck is the most movable joint, the smaller vertebrae, most movable joint. Other interesting things about the neck is the whole idea of forward head posture and how we have to help people correct that. And I'm just sitting up a little bit straighter right now as I look at this slide. So we know that a normal head weighs an average of 12 pounds, some more, some less. But the brain perceives the weight of the head as doubling for every inch it migrates forward. So if it's 1 inch forward, your head now feels like it weighs 24 pounds. 2 inches forward, it feels like it weighs 42 pounds. And that's going to cause all sorts of strain on your neck and upper back musculature. So we don't want to look like that gal on the left side of the picture with forward head posture and rounded shoulders. So knowing how to help people intelligently fix that problem is a huge part of what we do with our cervical treatments. So what I'd like to do is take you on a journey through the anatomical Bermuda Triangle. And of course, in massage language, that means the scalenes. In my opinion, the scalenes are one of the most overlooked and undertreated muscle groups in the neck. And a ton of crazy things can happen in this very small area, and you need to know how to navigate your way through this area in order to provide effective treatment. Let's take a little bit closer look at the anatomy. So the scalenes are housed between the SCM, the upper traps, and the levator. So I'll use my arrow here. You can see the posterior scalene, the middle scalene and the anterior scalene, and then in front of them is the SCM, and behind that is the levator and upper trap tissues. Here's the levator here, posterior, cervical, middle, or posterior scalene, middle scalene, anterior scalene. The scalenes actually originate up on the cervical vertebrae, the transverse processes, and they insert on the first and second rib. So they actually dive underneath the clavicle and insert down on the first and second ribs. And then, as you can see in this image, the C5 to T1 nerve roots pass through the scalenes before joining to form the brachial plexus. More about the brachial plexus in a minute. The other crazy thing about the scalene muscles is that they have a huge referral pattern, and oftentimes the referral pattern causes more pain than the actual adhesions or trigger points themselves. So the referral pattern goes all the way down the arm, kind of skips the elbow, goes into the radial side of the arm, so the thumb side of the arm, and also goes into the little finger side of the arm, all the way down the arm. That's what that says. And then also can cause a really persistent aching pain through the pectoral region, and this area here can cause a lot of pain, and of course that's right where the scalenes are housed. And then along the upper vertebral border of the scapula too, so they can go in the chest, the back, all the way down the arm, right into the hand on both sides. The brachial plexus and the subclavian artery pass through a small gap between the anterior and middle scalene. So on this image, this just shows you the anterior scalene attached to the first rib, and the middle scalene come down and attach to the first rib, and the whole brachial plexus comes out through these two muscle bellies, and so does the subclavian artery and vein. So it's a very small area where these nerves and blood vessels can get entrapped. The posterior scalene, which isn't pictured here, can also really become adhered to the levator, and the scalenes and the levator will pull up on this brachial plexus, causing thoracic outlet symptoms. And then below the scalenes and the levator, you have the pec minor tissues that can also pull up on this area. Pull down on this area, causing nerve entrapment. So the pecs insert from below and pull down. The scalenes and levators insert from above and pull up, and it causes entrapment of this whole brachial plexus and can cause a lot of thoracic outlet symptoms. So it's really important that you understand the anatomy of this area and treat it specifically so that you can help that type of symptom. So secret number 2, the summary of secret number 2, the bottom line is we really need to up-level our scientific approach and use intelligent treatment. And that's really step 2 to becoming an elite massage therapist. So let's take a look at what I mean by intelligent treatment as a whole. It's utilizing your knowledge of muscle origins and insertions and their actions to determine the best treatment approach. So in the example we were just looking at, you have to realize that the scalene tissues will pull up on that brachial plexus area. The pec tissues are going to pull down on that area and cause nerve entrapment. That's just one of a zillion different examples of how we can utilize our knowledge of muscle origin, insertions, and actions. We really need to master how to isolate each of the individual muscle fibers and groups. And again, the scalenes are a very good example of that. That's why I used this today, because the 3 muscle bellies, anterior, middle, and posterior scalenes, you need to treat those all 3 separately, and you need to give very precise work in that area in order to get effective results. You need to understand how the agonist, the antagonist, the synergist, and the stabilizer muscles all work together and they all can affect each other. You need to understand the whole pain referral patterns and how all of them are interrelated and how to communicate pain relief or pain referral patterns to your clients and helps them understand what's going on with their particular pain problem. You need to understand how the fascial connections can also affect the movement and the function. You need to know how to assess the function and movement of a joint or the dysfunction of a joint. You need to understand nerve innervations and so much more. So that's all what I mean by the science or intelligent treatment and what secret number 2 is all about. Janine is a great example of using intelligent treatment and getting really good results. She says that I feel so inspired and excited to use these techniques. When I put a client in side-lying position, it is so much easier for me and they feel the difference too. One client said to me, in 20 years of getting massage, I have never been put on my side before. She is now a repeat client and feeling so much better. Thank you for your wonderful teaching skills. Janine's talking about doing side-lying treatment for the neck and specifically the scalene tissues like we were talking about today. If you've never done much side-lying treatment, it's awesome for so many reasons and especially for treating the upper back and neck.